I'd like to turn over the podium to Dr. Nicole Lurie, Assistant Secretary for Preparedness and Response at the U.S. Department of Health and Human Services, who will deliver the charge to the workshop participants. Thank you.
Good morning, everybody, and thanks for being here. I actually think you've heard the charge now. And I just want to start by just thanking all of you again for being here, thanking Bruce and Victor and Mary and Diane and the whole planning committee, as well as Jack Herman and folks on my staff, Sally Phillips, Colin Weinberger, and others for getting this organized. You know, I have been in this position since 2009, since H1N1. And one of the things that's been very clear to me is that with every emergency situation that I've dealt with, we have realized in retrospect, and really in retrospect, that we've missed very, very important scientific opportunities to advance knowledge. That's really what this is about. In some sense, you know, we have this saying, never let a good disaster go to waste. But we also, by the same token, have obligations to be sure that the next time we confront a situation, we don't find ourselves in the same situation that we are now. And that's really the motivation for this workshop and the motivation for a broader initiative coming from my office, which we call Science Preparedness and Response. And it is really to say, just as we are prepared for disasters, we have to be prepared to do science when an emergency or a disaster confronts us. And so the components of sort of science preparedness are very variable, but they start with being able to figure out what are the important questions to ask and answer. How do we avoid a situation where we get to the end and we say, oh gosh, I really wish I had done X. And we're always going to do that, but I think we really believe that by bringing people together across a broad spectrum of disciplines and perspectives, that we can at the beginning scope out a much broader array of important issues and then be able to prioritize them. A second piece of our science preparedness initiative overall is to be able to get an infrastructure in place. Many of you know, for example, that during H1N1, for example, we were really challenged by getting university IRBs to move quickly enough for us to do important work. There's now in name a public health emergency IRB at NIH. I think the common rule when it gets to the end will help with this a lot. But whether it's moving IRBs quickly, whether it is pre-agreed upon, as Victor alluded to, trial design so that people aren't sort of duking out what the optimal trial design is for a vaccine or a drug or a therapy in the middle of an epidemic, whether it is biospecimen collection or banking, whether it is development of research networks or sort of research registries in a box that could stand up and enroll people quickly. All of those things are part of what I view as science preparedness and response, and things that I think we need to be able to talk about here. As I have been listening to the Zika conversation over the past several months, what I would say is I feel as though it is sort of characterized by things that characterize us in any emergency we deal with. You know, where you stand depends on where you sit. There's a fair amount of groupthink that always happens, and people see things from the perspective they're at. So whether you're a pediatrician or obstetrician, you know, whether you're a mom or a pregnant woman, whether you're a climate or environmental scientist, whether you're a geneticist, an engineer, a social scientist, a modeler, I mean, every single sort of group of people you talk to has a really different perspective about what it is that is important. And it's often the loudest voices there really carry the day. So the purpose of this really is to get that broad array across the whole spectrum of science and good minds thinking about what really is the research agenda. How do these different disciplines interact? How can people work together? So as you know, and as you've heard, a first part of doing this is to galvanize, get the research community together to identify what are important questions. So as you heard, we now have a standing contract with the national academies. It's our expectation that when we're confronted by new emergent challenges, that within 2 to 3 weeks, they're able to stand a workshop like this up, pull people together, and make not a set of recommendations, but a set of findings available to the public. We hope that those findings are really going to galvanize the research community to focus on important questions. We hope that they will galvanize funders, not just U.S. government funders, but funders well beyond the U.S. government, to support research in areas within their mission space. We hope that it will galvanize industry partners to help to develop vaccines, therapeutics, potentially new mechanisms of vector protection, whatever it is, but hope that our industry partners will come and help out with this important endeavor. To that end, I should mention that NIH, CDC, FDA, and BARDA are holding a countermeasure development workshop later in March, again to focus and drill down even more on the science related to countermeasure development. And frankly, to galvanize citizen scientists within this country, maybe around the world, and other kinds of interventionists to think about what they bring to this research agenda, what they bring to this fight, and to see how it is that we can address yet a critical infectious disease challenge going forward. We're not starting from scratch. There's already been a lot of good science. There is a lot of activity going on. There is a lot of infrastructure in place already from other infectious disease outbreaks, but I have high expectations that this workshop will move us well beyond that in setting a set of priorities for us. Understanding that as we learn more, those priorities will evolve and change. So thank you again all for being here. Thanks to the academies and everybody else, and look forward to the day's discussions.